with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 AM, radio that listens to you.
Hi folks, this is Dr. Virender Sodhi. Welcome to the show, Your Body is Your Natural Pharmacy. I'm very excited to be on the program again, and this program will be co-hosted with Dr. Shailinder and Dr. Anju. And so far I'm in the studio and I'm waiting for them to come in pretty soon. They should be here any moment. And if they are listening to the radio, they should hurry up and they should come to the studio as soon as possible. With that this is today's topic is about allergies. And we live in Northwest, and as you all know, the Northwest is very famous for allergies. And we see a lot of patients with allergies. I personally suffer with allergies myself, and I used to have asthma myself, and I am 100% cured from all these, and I will give you those tips. As the topic suggests, your body is your natural pharmacy. I will give you the tip how to get rid of the allergies permanently. And I used to have so many bad allergies. Like I walk out from my office, we have a park behind our clinic. As soon as I come back into my office, I will be sneezing. My eyes will be all red and itchy, and my nose will be running like a faucet. And I used to carry so many napkins in my pockets just to get rid of that allergic response. And with following the laws of natural medicine and Ayurvedic medicine, I have harnessed those allergies very beautifully. And I'm going to talk to you about how to do that for you guys. First of all, let's talk about allergies. What allergies are? Allergies are basically a hypersensitive reactions of your immune system to the things which other people's may not be. For example, when the pollen count, like now we have a lot of pollens in the air, and but not everybody is disturbed. So certain individuals who are sensitive to that particular allergen. Allergen means which causes the allergic response in you, and they can mount a reaction, and your body is trying to get rid of or flush out that toxin from your system, and that's why it's pouring out that mucus in you to get rid of that. But the problem is it's like a perpetuating. It's just go on without stopping that cycle, and we get a problem. This is very common worldwide. It's estimated that around 40% population of the world has some kind of allergic issues. Here in America, around 20% population has allergies, and almost we have $8 billion worth of cost attached to the allergies. Allergies can manifest in many different forms. One of the most common allergies most people connect to is anaphylactic shock. That is like when you get a bee sting, or you got a reaction to some injection like a penicillin, which was very commonly used drug, antibiotic drug, and a lot of people used to react very violently with it, and it was almost like a life-threatening. So in medicine, we understand the allergies can be different kind. One of them is called IgE oriented, and that's what the anaphylactic shock is. But it is only less than 2%. So you still are hidden and missed in 98% of the allergic response you can get. So most of the time when people go and to an allergist and they do a skin test where they prick the allergens into your skin and they see the reactions, and they find certain allergens are reacting to you, but that is IgE oriented, and you're only covering 2% of the spectrum. The rest of the 98% can be many different things. It can be a IgA oriented, it can be IgG oriented, it can be a T cell mediated, it can be due to antigen antibody reactivity. So many factors. There are so many variables. We still don't understand the complete depth of it, but I will teach you how to harness almost every kind of allergic response in you. So the other, which is very commonly seen in the public is food sensitivity or allergies to the foods. The seasonal, like right now, the pollen season is heavy, and we are feeling the allergic response from that. Dust allergy, which is very common. Dust allergy is basically, it is in the when people have carpets or the beddings, there is a dust mites, and dust mites itself is not a problem, but when they die, they actually get airborne, the fragments of their body, and that causes a lot of allergies. A lot of asthmatic patient has the dust mite allergies. Insect bites can cause a problem. Pet dander can cause a problem. Some people has a reaction to skin only. One of the phenomena which we call dermographia. What that means is when if you write on the skin, you can see it raises up, and it is just like you can see the name written on their body. You can call in for the questions at 844-301-1250. Again, the number is 844-301-1250. Again, continuing the on the allergies, so you can have eye allergies. Some people are just so much sensitive in their eyes. The drugs are known for having allergic reactions. There are chemical reactions. There is reactions to the mold. Some people are just on the sinuses only. They just get the runny nose. People can have allergy to latex. So there are so many different kind of allergies people can have. So the symptoms usually with allergies are sneezing, itchy nose, eyes. People feel like the roof of the mouth is kind of itchy, and they have red and watery eyes. And if people have a sensitivity to the food, usually they can feel a tingling sensation in their mouth. They can have a swelling of the lips, tongue, face, throat, hives, post-nasal drip, clearing of the throat. Like I have sensitivity to eggs. So whenever I eat eggs, I'm clearing my throat so many times. It is a form of a sensitivity reaction to it. So, and with the drugs, we can have hives and itchy skin, rash. People can have facial swelling, legs can swell. People get into anaphylactic shock. Wheezing is very common, which is like you have a hard time breathing. So these are the common symptoms which people have. When you have anaphylactic shock, which is kind of life-threatening, and you need to be very careful and need to be treated ASAP. The others are not life-threatening, but anaphylactic shock is very life-threatening, and you have to be treated very, very sooner. And people can lose the consciousness. They can have a drop in blood pressure. They can have a severe shortness of breath. And usually the treatment is you get epinephrine shots or you get antihistamine. Sometimes steroids are given, IV or even intramuscular. IV fluids are given to flush your system. So that is an emergency situation. And anybody who has anaphylactic history, they should keep EpiPen all the time with them. This is very important that if you have, keep EpiPen handy, and they are very inexpensive. Your doctor can write a prescription for you, and you should keep in your wallet, in your purse, or wherever you spend most of the time. Then next that the allergies and asthmas are very kind of interchangeable. Approximately 7 million children in America has asthma. And interestingly, since 1980, there has been a steep rise in the USA of asthma. So that makes you wonder what is causing this asthma, allergies, symptoms. Like I have seen so many kids, like newly born, just like a 1 month old, a kid, and they will have a allergic response, on the body. They have the asthma kind of symptoms, and they've been put on steroids, ointments, or they've been given steroid oral drops for that, and which does not fix the problem. It temporarily fixes it, but does not fix the problem permanently. So we have to look at what is going on, and especially going back to asthma, it is again a very scary statistics that since 1980, the asthma death rate has increased almost 50%. And this is right here in America. We're not talking about third world country. Right here in America, the death from asthma has increased 50% since 1980. And if you look at 1980, just was yesterday. It did not many years passed by. So what we are doing wrong, what is going on? And again, the death rate under 19 years of age has increased by 80%. So this is a very scary statistics, and we all need to look at it, that what we can do to prevent people to have the asthma, because this is a part of the allergic response to 50% people who has asthma has allergies. And the more female die with asthma than the male. and almost 60% of asthma death happens in females due to asthma. The African Americans has threefold more asthma and death with it. So there is something going on, which we need to look at. What is the causes of this all the problem with allergies? So one of the interesting thing is, which when people talk about allergies, they said, there's the genes. Yes, genes has a role in allergies. If one of your parent has allergies, you have 30% chances of getting allergies. And if both parents has allergies, your chances of becoming allergy is 60%. So it kind of doubles up. So, but that's it. If you have a genetic predisposition, then you cannot change the response in your body. No, that's not right, because genes are under control of your environment, and environment is controlled. One is by your thought process. For example, I used to be so allergic to grass, then whenever I used to go out, and I'll be like, oh my God, grass is here, and I'm going to have a sneezing fit, and I will be running into the bathroom 20 times to blow up my nose, and I used to even feel the tightness in the chest. And I love to hike, I love to go outside in the mother nature, and there is grass everywhere. So I used to send a message to my brain that I love grass. Guys, that is very interesting affirmation. When you send that message to the body start to change the behavior. So I used to send, I love grass, and over time, now I have no sensitivity to grass. I can even lay out in the grass, and I go and walk every day anyway, and my sensitivity is almost gone. So one of them is your thought process. You need to reaffirm your system that you should not be allergic to. It should not be, because not everybody else there is allergic to grass or any pollen or any dust mite. So second thing is your nutrition. If you're eating food which is aggravating the symptoms of inflammation in your body. So if you look at it, the allergic process is a inflammatory process, and the inflammation kind of makes your system prone to hypersensitivity, and hypersensitivity will create a disease in you, and you will have symptoms like the allergies. So to control the inflammation in your body, you have to follow certain rules and regulation. Watch your diet. What are you eating? Is it the food which is making you sick? Is the environment making you sick? First of all, if you are allergic to grass, I will not recommend you start lying down the grass, because you're going to get more aggravated. But over time, you'll get better. It may take, even in my case, it took me nine months to get rid of that process. And so what I tell my patient that, you have to follow the process slowly and steadily, and you will see the response changes in you consistently. And what I saw in me, that first year my response was almost 50-60% less. Second year was around 70 to 80%. Third year was almost gone. And now I don't have any issues with either allergies or with the asthma at all. For the last 30 years, I didn't have any asthma attack. So, we can do things to change it. The food is very important. Breathing exercises. That's how actually I cured my asthma, is doing the breathing exercises. The breathing exercise is a very simple process, especially for allergies. There are different kind of breathing exercise can be done. And one of them, which I did for the asthma, which we call kumbhik breathing, or like a pitcher breathing. So you breathe in and you hold your breath as long as you can, and then you slowly release your breath through your mouth. You breathe in through the nose and you release it through your mouth slowly. You're breathing through the nose and you breathe out through your mouth slowly. And so that way, what are you doing? You're concentrating the carbon dioxide in your system. When you concentrate carbon dioxide in your system, you are basically dilating the blood vessels and your lungs, and the spasms in the bronchioles, the small cells in the lungs, are getting released, and it actually relaxes and clear the mucus, and the plugs are gone, and your body is breathing normally. So simple breathing exercise helps it tremendously with the asthma attacks and the allergies attack too. So Dr. Shailinder just walked into the studio again, and I'm going to let him introduce himself today. And he had a long ride from Yakima, where he went to see his lovely daughter, who is going to finished first year of medical school.
Yes, thank you, Dr. Virender Sodhi, and it's my pleasure to be on radio again, folks. If you have a question, feel free to call us at 1-844-301-1250, and you are listening that your body is your natural pharmacy, and we are discussing allergies today. It's a very important topic, as you must have heard Dr. Virender talking about all the various allergies which happens, and we happen to live in Northwest, which is the greenest city in the world actually, and it comes with the beauty but also has lots of problems with the pollens and all the other allergies. So Dr. Virender, I was just listening how the psyche play roles in allergies, and that was very interesting because I have seen lots of patients in my practice, as you have. Some people comes and the thoughts and how they perceive things, they start having a reaction.
Yeah, so that's very true. Like sometimes you have to take the name of that food they are allergic to, and they will start seeing the reactivity, because the body start to go into that situation where they have that bad experience, and the body has memories, and the memories start to play on you, and you start releasing those cytokines, which is inflammatory molecules, and inflammation start the reaction of allergic response in your body.
So in other way, if you keep sending the positive message to your body that I'm not going to react, the chances are your body will probably somehow will lessen the effects of reaction, and you may be sensitive but not overreactive like sometimes does happen.
That's right. So again, I think this is, your body is your natural pharmacy, and it listens to you. You have to send the message. If you send the message and you do your things right, you breathe, you eat right, you sleep right, you have to sleep at night to get the best healing effect, and you do your part of exercises and your yoga, and you're right there. You're not only one disease, but you get rid of almost every disease from your body.
So one of the things I want our listeners to remember, that the reactions which happens in the body is just as a memory which really gets embedded into our system, and it has to have antibody exposure. So something like you have some allergen which Dr. Virender mentioned earlier, and your body somehow figures it out that it doesn't like it. Then what it does, it develops an antigen against it, and then that is when not the first exposure but probably the other consistent exposure bring that allergies reactions to your body. So, anyway, we have a caller on the line, I believe, and we will take the call.
Hi, this is Dr. Sodhi. Who is this? Hello, you're on the line. Hello? Hello?
Okay, so I think we have lost the caller. So please, again, feel free to call us at 844-301-1250, and we're discussing allergies, which is a very important topic. And, you can have all sorts of allergies, from anaphylactic reactions to sensitivities, please feel free to call us at 844-301-1250, 844-301-1250, and we are discussing allergies on the show, which called Your Body is Your Natural Pharmacy. I'm along with Dr. Virender Sodhi and myself, Dr. Shailinder Sodhi. We both practice at Ayurvedic Naturopathic Medical Clinic in Bellevue, and we have been in practice for how long, Dr. Sodhi?
36 years.
That's long of time, lots of time, guys. Some of you were probably, very young kids when we started the practice.
Yeah, it's interesting that, a lot of, we see actually now 4 generations together in our clinic, and the grandparents has come, then their kids has come, then their kids has come, and then we are seeing the 4th generation in the clinic, and sometimes that make me feel old. My God, I'm really getting old, or is it real?
You look handsome as usual, and you're staying healthy, and like you mentioned, you had allergies, and you have overcome your allergies.
Yes, exactly.
So, similarly, I had some exposures, and I had allergies, but since I noticed some of the environment when you change, you are not as hyperactive or hypersensitive to the allergens.
That's
and
right.
In your case, I think you improved the environmental factor, and you also did some of the routines which we tell our patients how to avoid allergies. In my case, was it just changing a home and getting rid of the old carpets
Yeah.
and the heating system, which was pumping out all that, even though we were changing filters and everything, that wasn't taking my allergies away.
Yeah. So these are simple things which we did, in our allergy removal kit, what I will call them. Like, for example, when I built the house, I did not put the forced air gas heat. I put the in-floor heating, which is a very clean heat. We didn't have any carpet in the house, which is, again, we put hardwood or stone. So you're cutting down the allergic responses in the body. And then, of course, we changed our diet. We did the exercise. Because when you're exercising, your body is getting rid of the toxic load. Basically, what allergic response is a hypersensitive reactivity. And your body has a toxic load which we make on a daily basis. But we also get rid of the toxic load on a daily basis. But when you're already full, your cup is full of the toxic load, now the same thing will start bothering you. So this is what you need to keep in your mind, that it's a toxic overload which you're triggering the response in your body. And if you keep your cup to the lower level of
so the reaction won't be the same.
The reaction will be less. Yes, exactly.
So we have a caller on the line. So caller, go ahead. You are with the Dr. Virender Sodhi and Dr. Shailinder Sodhi on the show Your Body is Your Natural Pharmacy, and we're discussing allergies.
Hi, this is Roseanne Kanhai. Hi, Dr. Shailinder. Hi, Dr. Virender.
Hi, Roseanne. How are you doing?
Can you hear me? Okay, so I'm listening. And I wasn't sure if you wanted me to wait for the end to ask or if you didn't mind being interrupted.
No, that's okay. You can go ahead and ask.
Okay, so something that you said resonated with me, which is sometimes when you give your body a negative message, it translates itself into an allergy. So when I came to this country, one of the things I struggled with was the cold, because I come from a tropical island. And at first I really tried to get into the cold and, go out in the snow and all of that. And then I got so tired of it, I started saying I hate this cold. And I was not looking forward to it. And as soon as it started to get cold, I was so upset, so distressed. And then in about 10 years' time, I developed an allergy to cold.
Yes.
So every time I go out into the cold, my skin breaks out into hives.
Exactly. Yeah, there's actually...
I think it's because I gave my body that message.
Exactly. Yeah, there is actually a form of allergies which people get with the cold weather too. And also there is vibration, pressure, elevation changes.
And
so go ahead.
pressures and all those type of cause the hives as well.
Exactly. Yes, go ahead, Roseanne.
Yeah.
So, you send a positive message to your brain and the response changed in you. And so that's a wonderful thing, just by sending a good message to your brain, you can change a response.
So have you noticed any change, Roseanne, that, since, you have been to States for a long time now, has your body accepted the cold a little bit more friendlier way than it in the past?
No, I think it has been the opposite.
So you're still reactive to you're still very reactive to the cold weather.
I think what happens is that the slighter the drop in temperature for the allergy to kick in.
Right.
Okay.
It used to be I have to be very cold and have a wind in my face. Now even a little bit of cold, I go out and I start getting a few hives, and then I run back in for cover because I know I'm going to be breaking out more and more. So I think my body is reacting quicker and quicker. The threshold for the reaction has become closer.
So again, the one thing is we talked about your cup, your body being a cup. And if your cup is full, you are going to have a more quicker response. So we want to keep the body clean. So it's like a spring. If you press the spring to the maximum potential under pressure, the spring does not have bounceability. It does not bounce back. And that's exactly happens with anything in the body, and allergies also that way too. So you have to keep your system more clean where your body can keep it. And again, the process is simple. Exercise, breathe, eat healthy, have a good sleep. And maybe some supplements can be helpful too. And there are lots of different things can be done to help that
the
process.
most commonly I think which I recommend is a turmeric. It's an amazing substance, and which like Dr. Virender mentioned right in the beginning, that your allergens, the histamines and the mast cells which produces, you can stabilize it with the turmeric, and it's an amazing spice. Not only every kitchen, Indian kitchens carry that, but there are other supplements like curcumins from Ayurveda and Ayush herbs which people can use to stabilize it. It's excellent. It's not only anti-inflammatory, but it works as a very supportive to the mast cells.
Exactly. So the curcuminoids, which is present in the turmeric spice, has a mast cell stabilizing effect. What that means is mast cells are the cells which come into activity when they come across the allergens or bacteria or viruses, and then they break down and they release histamine, and that's what we get the reactivity, runny nose and itchy nose, eyes and type of stuff. And when you are not allowing that mast cell to break down, you're not creating that response in it. So turmeric is phenomenally good for that process. And another herb which we also use is the quercetin, and we have a preparation which is called flucommune, which is also available at in the super supplements and other places, which people had a remarkable good results.
So thank you, Roseanne, for calling, and we appreciate your call, and I hope these small tips really help you with your allergies to the very extreme cold weathers.
Okay, thank you very much.
You're welcome.
I'm continuing to listen.
Yes, thank you. So we can ask why we are getting more allergic responses. Since 1980, the allergies has increased manifold, the asthma has increased manifold. The question arises, why we are getting so much allergic responses?
So, folks, we are ready to take your question. Please feel free to call us at 1-844-301-1250. 844-301-1250, and you are listening to Desi 1250 AM radio. And this is the show, Your Body is Your Natural Pharmacy. I'm with Dr. Virender Sodhi, myself, Dr. Shailinder Sodhi. We both have a practice in Bellevue, and we see all sorts of patients at our clinic, from pediatrics to geriatrics, you name it. We have seen it all. And Dr. Virender, we are discussing allergies, and you just brought a very interesting topic, so I would like you to continue with that.
So one of the things, which comes into mind is the toxic overload.
Right.
Because, we live in a society right now which has been bombarded with chemicals. Our bodies were never exposed to these chemicals in the history of mankind.
So what I really notice is usually people have multiple sensitivities sometimes. It's not the one single thing which they're, I hear this thing, I never reacted to this ingredient, but all of a sudden I start eating eggs, I start reacting. I haven't had that reaction. So, how do you explain that, Dr. Sodhi?
So again, what we have done is our food chain has been corrupted very badly. There is around 1,500 chemicals are put into the main of channels every year. There is more than 80,000 commercial synthetic chemicals has been released into the environment since World War II.
Wow.
And so these had not been tested on humans. There is no safety data available on it. So there is a huge, I think we are one who has created problem for ourselves.
So it's not only our food, but it's also our environment.
Environment,
which is toxic.
exactly. Yeah.
So, our air is not as clean as it. Our water is not as clean. What humans need is air, water, to survive along with, healthy food.
Yeah, it's very true, because the air quality has reduced. Like, we grew up in the Himalayas as a young kid. And this is funny that when we used to go to the plains from the mountains, and people used to look at us and say, God, what do you guys eat? You look so healthy. And the folks in the New Delhi or in the Punjab
plains,
area,
right.
they will be looking pale, and they will be looking unhealthy, and we will be looking so healthy, and we didn't eat anything extra.
It was their extra oxygen and the clean air in the mountains.
And the natural food, which
and
just,
the natural food,
which
what we grew,
there.
right? What we grew right in our backyard.
And we were very active kids. We were just playing a lot outside. And another thing what we have done to our kids, we've given them iPads, and we have given them iPhones, and we've given them the television. And a lot of research has been showing that these all are very detrimental for us, not only for us, but also for our kids. When you're not going outside, you're not exposing to the elements. And elements are our friends. They are not our enemy. And one of them is sun. Sun is a wonderful friend.
Right.
And there are studies and studies, one after another, showing that people who have allergies have a very low vitamin D. And how you get your vitamin D is free again.
It's just to expose your body to the early morning sun rays and, spend some half hour. You get enough vitamin D in your body. You can even have from the capsules. So, folks, you are listening to the Desi 1250 AM, and this is Your Body is Your Natural Pharmacy, hosted by Dr. Virender Sodhi, myself, Dr. Shailinder Sodhi. We both are practitioners at Ayurvedic Naturopathic Medical Clinic. Feel free to call us at 1-844-301-1250. We will be coming back right after the breaks, and that will be about 30-second break, and we will talk to you. Please feel free to call us at 844-301-1250, and we are discussing allergies.
Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 AM, radio that listens to you.
Welcome back, folks. We are discussing allergies on the show, Your Body is Your Natural Pharmacy. I'm with Dr. Virender Sodhi, myself, Dr. Shailinder Sodhi. So we are discussing allergies, and we have a caller on the line. Caller, go ahead.
Hi, Dr. Sodhi.
Hi.
I have a question. I have a couple of questions.
Okay.
One is I'm curious about the pediatric allergies that it seems like are coming up more and more.
Yeah.
So you talked about environmental toxins and that kind of thing. What about kids who are showing food allergies early, and how do you determine what they're allergic to and then how to solve that?
Yeah, it's a difficult one. But, one thing is when the kids are in the womb, mother has to be very careful. She should not be exposed to the toxic chemicals. And I believe, there is a lot of factors, and one of them may be vaccinations. And they have mercury in them, and I'm not against vaccination, but I'm considering, that is one of the biggest problem there. And then food chain, again, there is so much chemicals, then the plastics,
Right. I think you brought a very interesting topic that mother, right, when they're pregnant, they need to have very healthy diet, very clean diet, organic type of diet.
Exactly.
So the less exposure to the fetus right in the womb. And that's such an important topic, which I believe we all need to understand, why the newborns are becoming so much sensitive immediately,
Exactly.
which has not been the case in the past.
Exactly. And, the another thing is we also not doing, if we don't breastfeed the kid, we are not making the immune system stronger. The breast milk has all the vaccination which you need to have for that kid.
And it provides such a strong, immune system. It solidifies the newborn's immune system right from the, birth, right? Yeah. And having natural birth actually also gives them a strong immune system.
Exactly. And unfortunately, the kids who are born in the hospital has more sensitivity than the kids who are born at home. And this also brings up very interesting concept again. When the kid is born, his system is completely sterile.
Exactly.
And as soon as it comes out of the vagina of a mother, the mother's vagina inoculate thousands of bacteria into his system,
right.
And then start that reactivity to boost up his immune system.
It's like a natural immunization.
Exactly.
What we are trying to do with our babies. So, that's such an important factor, that having natural birth, eating healthy during pregnancy, and also breastfeeding the little ones for as long as possible. I mean, how long you would suggest, Dr. Virender?
I will say for 1 year at least.
And that's exactly what my belief is.
Shailinder was lucky he was breastfeeding for 5 years. But
no, I don't think that was the case. But anyway, but 1 year is amazing. But I think the maximum I would recommend is 2 years. And also the introduction of the solids.
Yeah.
So solids actually, sometimes parents are very busy these days. They work multiple jobs and they don't have enough time to spend with their little ones. And the moms, out of the, because of their struggle to survive for financial reasons or other reasons, they choose their job and money at the first spot, and they will try to introduce solids so baby can be off of the breast.
Yes. And not only that, a lot of times patients come to me, they have this organic carrot, and they have organic this in a jar or pear. And you look at it, said it has to have preservative in it. And the baby is not need to have preservative.
Right.
He needs a fresh thing. How much time it takes to grind up the pear or grind up a carrot or something of that nature. And so I think we are looking at a convenience at sacrificing the health of a kid.
Right. So, this is very important chapter for the moms and also very really important topic for discussion, that when we are discussing about the children's allergies, that we need to remember that children's gut does not start maturing in early age.
Yeah.
It takes at least 1 full year. As far I'm concerned, I would probably consider introducing solids probably after 9 months to 1 year age.
Exactly.
And not before that. Before that, breast milk is the best food for the baby, and mom should be eating all the foods, all the small things which they want to introduce to the baby through the breast milk, because all what you eat is being passed on to little ones through your milk.
Yeah, that's actually very Ayurvedic concept. Like even older Ayurvedic doctors, when kids used to have a problem, so they did not give the medicine to the kid. The medicine was given to the mother, because the milk is a secretion of the extension of the body, and it secretes into the milk, and the baby was getting medicine from that, and actually has cut down the side effects already, and is very safe for the kid. So a really interesting concept, which we are kind of not doing it anymore.
Yeah, so exactly. This goes with our theme. Your body is your natural pharmacy. So what we feed ourselves, you pass it on. So, caller, the question when it comes to the pediatric allergies, we definitely want to make sure mom's health is at the top priority, and the little ones are exposed to minimum amount of allergens. And, and there is a way of introducing the solids.
Not only, there is another interesting concept which has been the hygiene concept. So
Right.
what we have seen, I've seen in my family too, like the mom will have that wipes, which is specially made with alcohol, and she wants to wipe the kid. She wants to wipe the hands of everybody who's holding the kid. And I was so upset at that lady. Said, "Darling, you're not doing help to the kid, because we want to have the exposure to the bacteria. That's okay. It's
Right.
natural."
So, having super clean house, all those wipes, disinfectants, actually not doing really good things for our little ones.
No.
I remember playing myself when
In
I
the
was
mud.
a little bit in the mud and the dirt outside.
Exactly.
And we were running into the
we
woods.
even ate that.
Right,
You
and
know?
clinging to the animals and hugging the dogs and cats, and had no such reaction because we were so much open to the environment.
Exactly. This what you brought is a very interesting concept again. The kids who are born in the farms has a less allergic responses than kids who are brought up in the cities. And so there has been studies done where kids has allergies, and the kids were asked to go on the farm, work with the animals, work with the dirt. And this is one of the treatment which I give to my patient. Many of my patients may remember this. When they have allergic kid, I said, okay, do you have a farm? Do you have any kitchen garden? And if they don't, I ask them to create a kitchen garden and let the kids play, because you are going to get exposed to different bacteria through the dirt, and that bacteria are going to help you to boost your immune system.
Right, and picking up the berries and fruits right from the wild and eating just as it is.
Exactly.
It really produces very positive response in the body. So, folks, you are listening to Desi 1250, and this is a show, Your Body is Your Natural Pharmacy. I'm along with Dr. Virender Sodhi, myself, Dr. Shailinder Sodhi. Feel free to call us at 1-844-301-1250. Do we have another call? Caller, go ahead. You are on radio with Dr. Virender Sodhi. Your Body is Your Natural Pharmacy, and we're discussing allergies.
Yeah, hi, Dr. Sodhi. This is Deepak here. I have a question about my son. So he's 10 years old, and he's had a history of asthma for the last at least 5-6 years now. And every year it's a seasonal thing. Our biggest frustration is, every time we go to, the pediatrician, they give him the steroids, and, that cures him immediately. But over time, we can tell, he's starting to get overweight, and all in all, the steroid is just not a great solution. So any suggestions, any help you can give in, as to what we can do to do a better job, and how can we cure this asthma thing?
Yes, Deepak, you brought a very good question, and you're not the only one. When the pediatric emergency with asthma is number one hospital stays in the whole USA, so it's very, very common. And
also scary too.
Scary, very scary, yeah, because especially for parents, when they see their kids not breathing, it's very, very scary. The one interesting thing is what you brought in, the steroids. Steroids are wonderful medicine when they are used for short term and emergency, but they are not the best medicine
for the long term. Is
use.
not.
Yeah.
But the one thing is, Deepak, you have to remember, if your child is getting asthmatic attacks or some sort of allergic response is there. So like right in the beginning when Dr. Virender started the show, the thing is cutting down the exposures to the allergens. That's the primary thing to note down. And finding out what your child is allergic to is very important in this case.
Exactly. So, if you have an allergist, he can check it for IgE-oriented, which is like a skin prick test, and it also can be done through the blood too. So, but that is only 2%. So you're still missing 98%.
Yes.
So there is another test which can be done, which is called IgG and IgE-oriented, which is done on the food. Food is a very interesting component.
Right.
We see a lot of, it's funny, a lot of allergists put that concept down. But when we do the testing, these kids have allergy to so many dairy and this and that. And when the kids avoid that, they get better.
Right. So remember, Deepak, what we mentioned is that your cup have to be up to certain level of the full when the allergic response will happen in your body. So what we are talking about is the accumulative effects of allergen on your body. So if we reduce other allergens, your son, which he may be very allergic to, say, pollens or some sort of grass or some tree pollens, even if we get exposed to that, his response won't be that strong if we have other allergens lesser in the body.
Exactly. So the food is one. The dairy product is the biggest culprit. Sugar is the biggest culprit. The hygiene of the house, not in the sense of a bacteria, but dust mite. Dust mite control is very important. The forced air heat is a big problem.
It's a huge problem.
It's a big problem because you're not only throwing the dust particles in the air, but also you may be sending some gas and stuff, other things too.
Right. And, no matter how much you do, those will continue to happen. Unless you change the filters so regularly and put those small filters in the room but you can cut certain amount of load. But kids who are hypersensitive, they will react. So having those ozonizers or those air cleaner.
So ozonizers sometimes irritate your lungs, but the carbon filters are very wonderful for absorbing the toxic materials, and you can put on the furnaces too. You can also put standalone unit in the kids' room.
Right.
Removing carpet is the easiest thing to do. It's a very, nowadays if you're a small handyman yourself, you can install the hardwood floor in the room, especially not everywhere, but in the kids' room or where he spends most of the time.
Right.
And again, watching the diet, activity, take them out, sunlight. Sunlight makes vitamin D. You are going to cut down the asthma attacks way down when you are exposing the body, and that means exposing the body, not covered up the body.
Right. So have babies go in the shorts and let them play in the sun.
Yeah, make sure that his chest is not cold.
And your kitchen is your pharmacy, like we mentioned. Is you have all those things which you need. Turmeric is a great antihistaminic. Ginger. All these things can be given to the little ones. By mixing up in a little bit honey if you need it, and that's one way to do it. Other thing is just having allergy tests done, which
food
sensitivities, to make sure which foods are the major culprit. I mean, we can tell you some of those foods are like cow dairy is a very big one. Then citruses are the other ones.
Wheat is another
one. And
nightshade family.
And out of the nuts, we usually don't recommend peanuts because the majority of population are very much sensitive to the peanuts.
And a lot of fungus in them too.
And then fungus that leads it. Yeah. So cutting down all these common allergens which we mentioned, you can probably reduce a lot of load from your body, the histamine, which will cut down the allergic response.
And teaching them how to breathe, because breathing, you can also make into fun. Like, yes, to teach a 10 years old breathing exercise can be a little difficult, but you can bring a lot of balloons and blow the balloons and teach them how to blow. So they're doing lung exercise.
So folks, feel free to call us at 1-844-301-1250. You are listening Your Body's Your Natural Pharmacy from Dr. Virender Sodhi and myself, Dr. Shailinder Sodhi. We both are physicians at Ayurvedic Naturopathic Medical Clinic in Bellevue. And feel free to call us at Bellevue Clinic at 425-453-8022. 425-453-8022. That's the clinic number. In order to talk to us right now live, you can call us at 844-301-1250. 844-301-1250. You are listening Desi 1250 AM.
Yes, again, continuing with the food section again, a lot of parents, what I see is bring the packaged food for the kid, like nachos and chips and colorful Cheerios.
Oh man, I tell you, those foods are
garbage.
So misbranded in a way that the amount which is put is, we don't know what is actually there, what type of preservatives are there.
Exactly, and the sugar. A lot of these kids' cereals are so much loaded with sugar.
And the worst thing is that those artificial colors,
Exactly.
which they call natural colors, sometimes they would not tell that these are the synthetic colors or anything. So they are the major culprit for allergies behind.
Exactly. And if you put sugar, your immune system, your white cells become very sluggish. So they are not allowing to clean the body. They actually are, your system become like overloaded with the garbage. And now you have the cup get full. And now you have a problem with that.
Right. And Dr. Virender, I would like you to mention one of the common treatment which we recommend to our patients at clinic is called Neti Pot.
Yes.
I would like you to just do that. We have a caller on the line. We will discuss Neti Pot right after caller's phone call. Caller, go ahead. You are with Dr. Virender Sodhi and Dr. Shailinder Sodhi on the show, Your Body's Your Natural Pharmacy. Go ahead.
Hi, Dr. Sodhi. This is Seema Sharma. So I have a question for you. Is it safe to take an over-the-counter allergy medication?
Yeah, that's a very good question. The antihistamines are very commonly utilized medication. And it is kind of safe, but, it doesn't solve the problem. But, you have lots of side effects. Whenever you take Benadryl or Claritin or other things, like Benadryl has a drowsiness and you may not be able to operate the machines. And there are non-drowsy antihistamines like a Claritin or cetirizine. Cetirizine also has some kind of drowsiness attached to it.
Certain population
will do that. So it's not the safest kind, but I have not seen that it will cure the problem. And I see a lot of patients.
Right. So, Seema, I think your question is valid in a way when we need an emergency treatment and you don't have anything and you got a Benadryl in the counter or in your room, in your house, that can be given safely to cut down the side effect of any severe allergies. But the long-term treatment, no. It does not solve the long-term issue at all.
Exactly. So it's just a good emergency medicine for short-term, but not for long-term.
And we have another caller on the line. You're listening to Your Body's Natural Pharmacy with Dr. Virender Sodhi and Dr. Shailinder Sodhi. Caller, go ahead.
You may have just answered the question. I didn't hear the last caller's question, but I was curious about an acute histamine attack and what you do about that, and then what are the long-term kind of downsides to taking antihistamines?
So again,
Yeah.
So when you have acute attack, the antihistamines are phenomenally good to control that, and there are different classes of antihistamines which can be utilized. Some of them are non-drowsy, some of them have a drowsiness like Benadryl. But the long-term effect, they actually also not helping your immune system. One of the concepts which I have a hypothesis that these synthetic molecules are not natural molecules. So they go and work differently and they latches on, and the body over time creates a sensitivity to those and create a reaction to those. Whereas the natural molecule does not. If you want to go to the natural molecule, we have bioflavonoids. Bioflavonoids in the mother nature are colorful things from the fruits and vegetables and different plant origin, like a tomato has a lycopene, is a bioflavonoid.
Right.
And your turmeric has the yellow pigment, that's the curcuminoid. The blueberries has those blue pigments, anthocyanidins. So these are bioflavonoid. They have phenomenally good effect on the stopping the allergic response and stabilizing the mast cell. So basically what we need to do is remove we have been using the concepts of a cup here. So we want to keep our cup lower filled, not fully full. So you watch what's going on around you, environmentally, food-wise, good amount of sleep, and then you plug in what you need to do. For example, you can be given quercetin, or you can give flucomune, you can give curcumin. Ayurvedically, the allergy response is also because of digestion. Because you're not digesting your food. So
and the one thing, the caller, you had a very good question. The long-term use of the antihistamines, over-the-counter one, what it does is actually it also slows down your digestion, and that really works against the idea of that you're going to you will cut down the allergies. It does give you some benefit in the quick response, but for the long-term continuous, or I will call chronic use of antihistamine, definitely compromises you at very different levels, from your joints, dry joints, to thyroid gland, and you name it, it will compromise that. So I do not recommend anybody who have allergies and constantly using over-the-counter antihistamines for long-term use, but come to some natural resources, like I mentioned about the neti pot. Dr. Virender, I will let you discuss that.
Yeah, so neti pot actually has become very famous all over the world now. Dr. Oz did a show on it. Oprah Winfrey did a show on it. And this is a original Ayurvedic technique.
And we called it Jal Neti.
Jal Neti. You're flushing your nasal passages with salt and baking soda. So you put a little pinch of salt and a little pinch of baking soda. So 1/4 teaspoon of each. And you take 1 glass of water. You dissolve it in. And there's a special pot available which is called neti pot. You put into that. And then you put into one nostril and tilt your head on the side. And
in such a way where the water flows from the other side.
Exactly.
Right. And even if it doesn't flow, it doesn't matter. You can still washing that, at least that particular side, and you can go to the opposite side to do that.
Yeah. Then the people, but what I've seen is, Dr. Shailinder, is that people who has a chronic sinusitis, that bothers them. For them, what I tell them to do a nasal saline spray, because body doesn't get stuck in it.
Right.
And we also do a nasal treatment, which we have a specialized oil application, and which is called Nasya in Ayurvedic medicine. So the medicated oil are used. So what this does actually creates a layer of that oil on the mucous membrane.
And it gives a protective effect.
Yeah, but then if the pollen or virus or bacteria cannot attach to the mucous membrane of the nose, it does not cause the reaction.
Right.
So in Ayurvedic medicine, this is used on a daily preventive method. I use Nasya on a daily basis, like brushing your teeth.
So we have other caller. Caller, go ahead. You're on the show with Dr. Virender Sodhi. Okay, the call got dropped. So anyway, so we'll continue with the Jal Neti. And Jal Neti is a very nice way to rinse off the nasal passages where the allergic response happens. And also, what Dr. Virender was saying, followed by the Nasya with the oils.
Yeah.
And the best oil is?
Yeah, you can use sesame oil, you can use olive oil, you can use coconut oil. It depends.
Or you can use the ghee as well.
Yeah, exactly. So basically, you can use, in Ayurvedically, we talk about different body type, different constitution. But if you don't know what constitution you use, safely you can use sesame oil or olive oil. It's not a big problem. It does not cause a big issue with there.
So the one methodology of doing Nasya is, once you have done the nasal lavage, the nasal passage wash, just taking a couple drops and just sniff it in each nostril, or applying the ghee to the fingers and just rubbing into the nostril thoroughly. So it shows you, folks, you're listening to Your Body's Your Natural Pharmacy with Dr. Virender Sodhi and Dr. Shailinder Sodhi. And we have a clinic, Ayurvedic Naturopathic Medical Clinic in Bellevue. And that we do take insurances. Please feel free to call us anytime at our clinic. The phone number at the clinic is 425-453-8022. 425-453-8022. That's the Ayurvedic Naturopathic Medical Clinic. And you are on the radio, Desi 1250, and we are really discussing allergies, which is actually major cause of lots of issues in the United States, but also in worldwide, isn't it?
Exactly. It has become a worldwide, and the more country got developed, the more allergies they developed.
So more advanced we are getting, in a way. We are
exactly.
It's like we're running away from the Mother Nature.
Mother Nature, exactly. So to sum up, because time is running out. So one thing is you have to change your diet. You do your exercise. You do your breathing exercises. Do your yoga, and then cut down the environmental toxic load. This is not good for you, because the more you put in your system, don't buy any packaged food. Eat the real food.
Eat the very natural food. What nature gives you is the best. And eat in a clean environment. Grow your herbs in your backyard. So that's a very important, message and concept. So, folks, as we are coming to the closure, next week we will be discussing spring detox, how to do a detoxification. and that will be with me. Dr. Virender is off, but Dr. Shailinder and Anju will be here. So we will be here from 1 to 2 p.m. at Desi 1250 a.m. You can download the app, Desi 1250 a.m. app, on your phones to listen to us. And, we are ready to leave. So thank you very much for listening to us. Have a good day.
You're listening to the only Desi station in the SeaTac area. Your connection to all things South Asian. Desi 1250 AM. Radio that listens to you.
If you are looking for Indo-Chinese dining with an eclectic ambience, visit In Chin's Bamboo Garden, located in Redmond at 16564 Cleveland Street. Each dish is prepared from scratch with its own distinct quality and taste.